Hello, good morning, good afternoon, good night to everybody. Since it is global Zoom webinar on new trends in global health diplomacy during COVID-19 age, perspectives from Turkey and Japan. This is the title of our symposium, and this project has been run by the TOBB Economics and Technology University Department of Political Science and International Relations. Let me introduce with our project team. And Şaban Kardeş is our project manager, and also Bahadır Pehlivan Türk is just like me, one of the project coordinators in that project. We have two legs in that project. First one is global health diplomacy, and the second leg is maritime security. And we are going through elaborate these issues from the Japan and Turkish perspectives. This is the idea because of lots of similarities and benchmarking capacities between these countries. As a department, we have been running many projects between Japan and Turkey thanks to the Bahadır Sensei. He doesn't only runs project on Japan, but also we have very robust curriculum on Southeast Asia as well as on Japan. So it makes our curriculum and our students so capable on the South Asia and Japan issues. And we also sent lots of students as they graduated as postgraduate students or for other, let's say, occasions to Japan. It makes our departments be proud of that issue. Although we are very young university, but we are very ambitious, and our ranking in Turkey as well as in the world among the young universities is very remarkable. That's the issues I just want to raise, and we are so happy to open that gate from our country to Japan to discuss all these issues. And I'd like to make and express my special thanks to Bahadır Sensei for his endless efforts for this issue. And let me give the floor to our Dean. She's going to make a speech. Thank you very much. I'm looking forward to listening to you and your expertise. Thank you for joining us. Asena Sensei, floor is yours.
Thank you, thank you. Dear Minister, dear colleagues, and dear students, it's my pleasure to welcome you to this webinar. I should begin by saying thank you to the organizers of this event for bringing us all together, especially to my dear colleagues Haldun Hoca and Bahadır Hoca for their diligence, and to the Embassy of Japan for their generous support. As we all know, COVID-19 has changed our lives in many ways. It has disrupted daily life across the globe. More than the September 11 terrorist attacks and more than the 2008 financial crisis. The effects of the disease itself, combined with social distancing, quarantines, lockdowns, and travel bans, have been significant. No event since the Second World War has triggered such pronounced worldwide effects on human behavior in such a short span of time. The current pandemic has also generated some important new questions for the international relations scholars and policymakers. One of those questions is whether year 2020 will be seen in the future as a point of inflection in international relations. In other words, when this thing is over, whether it will have transformed the fundamental factors such as the distribution of power and the distribution of interests in the world. About the distribution of power, for example, we know that the pre-pandemic status quo was a slow shift toward bipolarity with China and the US as the main strategic rivals. Although these two countries handled the pandemic in different ways, with China containing the virus quickly, whereas the US still facing a surge in the number of confirmed cases and deaths, it's not clear whether the distribution of power has changed. In the financial realm, for instance, the US has unleashed the world's biggest monetary stimulus and the world's biggest budgetary stimulus at virtually no cost, hence displaying its financial power. China, on the other hand, did not make much progress in augmenting its soft power when the health supplies it provided to other countries were found substandard and when it was subject to allegations that it was less than transparent in the early critical phase of the epidemic. Coming to the distribution of interests, in the pre-pandemic years, there was a slow trend in the domestic interests of the great powers towards more closure. We wonder whether COVID-19 will permanently change the trend, for example, by affecting public hostility in the US towards Asians, or by causing drastic shifts in the global supply chains or in migration patterns. Therefore, it is still an open question whether COVID-19 will cause any dramatic shifts in the distribution of power or in the distribution of interests in the world. Yet we're far away from saying that the pandemic had no effect. In a counterfactual world without the pandemic, it is possible, for instance, that the election results in the US would have been different, which could have system-altering effects in the years to come. Another possible effect of COVID-19 would be on the trade-off between efficiency and resilience. As we know, maximizing efficiency has been the cornerstone of economic thought. A prioritization of resilience at the expense of efficiency may shift national interests to a different set of objectives. And another interesting question is about the best course of action to take during health-related crises and comparison of autocracies versus democracies and their own strengths and weaknesses. COVID-19 has demonstrated that the two forms of government each have specific strengths and weaknesses when it comes to dealing with external emergencies. Autocracies with high state capacity are capable of swift action, but they can also suppress information about an emergency or resist popular demands for a response. In democracies, in contrast, it is harder to suppress information or to ignore popular demands to do something. But the inherent decentralization of power in a democracy can lead to a slow response. In other words, we need a combination of transparency and swift action. One solution to this may be, as some scholars have suggested, to increase the disease preventive capacities of democratic nations without necessarily granting them emergency power to the central authority, to be specific, which may be abused. The downside of this solution is that it is politically unattractive. Indeed, Gerald Ford is cited in the literature to have launched a vaccination campaign in the winter of 1976 when a new variant of the influenza virus appeared. But then the new influenza strain turned out to be far less deadly than imagined, and the president was ridiculed by both the left and the right of the political spectrum. Over and above all these issues is the clear need for health diplomacy. In time, we have observed that health has become a more critical element in foreign policy, security policy, development strategies, and trade agreements. A rising number of health challenges can no longer be resolved at the technical level only. They require political negotiations and solutions, and often they need the involvement of a broad range of actors. To address issues of common concern that need the cooperation of many countries, global health diplomacy is needed, but health diplomacy can also play a central role at the regional, bilateral, and national level. Therefore, countries will need new skills to negotiate at all of these levels and in the face of other interests. Many examples show that health diplomacy works and that the alignment of health and foreign policy can generate significant benefits for health. There's an increasing recognition of health as a goal of foreign policy and as a key contributor to development, peace, poverty reduction, social justice, and human rights. Health diplomacy can have an important role in supporting sustainable development by addressing health as a social and economic issue of high relevance and in dealing both individually and collectively with health challenges. It can support countries in protecting joint interests and in taking positions on matters of common concern, such as access to health security, health promotion, disease control, access to medicines and technologies. So once again, welcome to this great event, to this organization. So I stop talking here and leave the floor to the panel. Thank you.
Thank you very much, Professor Caner, for this opening speech. And before, making anyone wait, let me move on to our keynote speeches. And our first keynote speaker is Mr. Kita, Mr. Yosuke Kita. He's coming from Japan, but currently he's in New York, and it is quite late in New York now, so I'm not going to waste any more time. Let me introduce him briefly. Mr. Kita is actually a medical doctor. He's a graduate of Mie University School of Medicine in Japan. And he has a Master's of Public Health on Yale University School of Public Health, and he has a Master's of Public Administration from Harvard Kennedy School. He started his career as a physician. He took on many jobs in Japanese government in the Ministry of Health, Labor and Welfare. He has been the medical officer for HIV and AIDS. He has been the medical officer for Global Malaria Program. He has been the medical officer for National Immunization Program. And he was a medical officer in the Division of Health for the Elderly. And he also worked in the Yamagachi prefectural government on different positions. And he became the director of Office for Global Strategy of Medical Service and Health Industry in Ministry of Health, Labor and Welfare of Japan in 2019. And between 2019 and 2020, he's been the Senior Coordinator for Global Health, again in the same ministry. In the past, he has been medical officer at the Global Malaria Program in the World Health Organization, Geneva. And currently he's in New York. He's a counselor in the permanent mission of Japan to the United Nations. Thank you very much for coming, Mr. Kita.
Okay, thank you very much for your kind introduction. And I would like to express my deep appreciation to the professors of TOBB-ETÜ for organizing this symposium and giving me the chance to speak on behalf of Japanese government. I would like to show my slide first. Okay, so the world continues to struggle with COVID-19 pandemic. The start of vaccination programs in some countries gives us a hope, but we need to remain vigilant. Under such circumstances, I welcome this timely symposium in TOBB-ETÜ. Indeed, the COVID-19 is affecting the international peace and security. The emergence of new variants reminds us how hard this historic challenge can be overcome. We should also be always mindful that this human security crisis impacts not only on people's health, but also on socioeconomic aspects, particularly in the most vulnerable communities. So this is the outline of my today's speech. Firstly, I would like to review the overview of the epidemiological status of Japan COVID-19 status compared with other countries. When the pandemic hit, experts predicted that Japan would be hit hard by the virus, with some saying as many as 400,000 residents could die of COVID-19 diseases. The country didn't enforce a widespread shutdown, this is a lockdown, and tested only less than 1% of its population and was slow to cancel the Summer Olympics even as the countries set to participate lockdown. Japan did not use surveillance technology the way China and Singapore did. And it did not employ widespread testing the way South Korea did. But even though at least 26% of Japan's population is over age of 65 and at a higher risk of getting seriously ill with COVID-19, most people did not get sick. Some newspaper articles said that, but even experts don't know the reason why Japan is at this kind of low case of the COVID-19 or the death cases of the COVID-19 as of now. A list of possible reasons circulating online includes an existing culture of mask wearing or lower rate of obesity, or the government's early push to close schools, and a claim that speakers of Japanese emit fewer viral droplets than speakers of other languages. Some have said there are other cultural factors at play, and Asia Times report described Japan as less of a touchy-feely nation than places like the United States, with more of a focus on cleanliness. It also has a dedicated public health system. And this is epidemiological status of Japan COVID-19 compared with other other countries, including Turkey. I would like to take a quick look at the status of COVID-19. First, in comparison with other countries like France, Turkey, Germany, US, Canada, UK, India. And this is the number picked from the Johns Hopkins University's website. And the first one is the number of new infections per day per million population. The number is high in Europe and the United States, as you may know, and low in Japan. And as you may know, Taiwan and South Korea and Hong Kong in other East Asian countries are having the low cases or low death rates. And next one is a daily death toll per million population. I think the trend will be the same here with the cases. And next one is the number of daily tests per 1,000 population. This is not a good thing for Japan. And China and South Korea, which experienced the SARS epidemic in early 2000, have been building up their PCR testing capacity so early, but Japan's testing capacity has become a weak point. And this is a graph showing how much testing is being done around the positive reports. The higher the number, the more thorough the testing is presumed to be. So in Japan, it is said that the number of positive cases is hidden because the number of tests is very low. But from this graph, we can say that it is not considered to be an underestimate because a certain amount of testing is done compared to the number of positive reports. And this is the number of vaccines given per 100 people as of today. And unfortunately, Japan is also at a low level. This is kind of a failure to introduce the newly vaccine of COVID-19. So the people usually say that the reason why the Japan is really late to introduce the vaccine. There are many reasons for the delay in the introduction of the vaccine. including the fact that the rules of the pharmaceutical administration are really strict in Japan. So the administration usually needs strictly domestic clinical trials. And it has also been pointed out that the number of patients was so small in Japan, so the clinical trials did not proceed well in Japan. So let me proceed to the second phase in the government response. The first one is containment phase 1 for Wuhan evacuation program, and also for the Diamond Princess evacuation. So the Japanese government's initial response to the COVID-19 outbreak was our containment policy centered on the repatriation of Japanese nationals from Wuhan, China, the site of the pandemic outbreak, and the introduction of new border control regulations. On January 24 last year, the Prime Minister Abe convened ministerial meetings on countermeasures against the new coronavirus at the Prime Minister's office in response to the World Health Organization's statement that it had confirmed human-to-human transmission of the coronavirus. Prime Minister Abe announced that the appropriate disease control measures would be introduced in cooperation with the National Institute of Infectious Diseases. And on January 31st, Prime Minister Abe announced that he would prioritize the repatriation of Japanese nationals from Hubei province, where Wuhan is located. The authorities negotiated with the Chinese authorities and dispatched 5 charter flights to Wuhan from January 29 to February 17 to conduct a return operation for Japanese nationals who had been residing there. And on February 5, Prime Minister Abe invoked the quarantine law and quarantined the cruise ship Diamond Princess in Yokohama, near Tokyo. And the quarantine officers were dispatched to the ship to prevent crew and passengers from disembarking and escort infected patients to medical facilities all around Tokyo. After the outbreak of COVID-19 on the cruise ship Diamond Princess, the Japanese government shifted from a policy of containment to one of prevention and treatment because of the expected expansion of the community in Japan. So the incident on the Diamond Princess occurred suddenly in early February, and as it turned out of a total of 3,711 people, which consists of the 2,666 passengers and 1,045 crew members. And after all, 706 people were infected, of which really solely that 4 people has passed away. And the passengers and crew came from 28 different countries, and making it unprecedentedly difficult operations. Of course, this was a new experiences for us. At this time, the mass media in the countries of origin of Diamond Princess passengers were really critical of the Japanese government's response. Some newspapers said that, for example, the quarantine plan failed, causing the largest spread of the disease outside of mainland China. And the other newspaper says that Diamond Princess is a boiling pot of infections. And the other one said that the experts outside Japan are questioning the Japanese government's decision to keep so many people on board for 2 weeks, and so on. And we have really strong pressure at this time. So as a result, we had to hold frequent briefings and press conference at the Ministry of Foreign Affairs for the embassy in Tokyo, like these movies.
Hello, my name is Yosuke Kita, Senior Coordinator for Global Health in International Division of Ministry of Health, Labor and Welfare of Japan.
The man sitting next to me is a Dr. Oni. He's still now working as a chair of Japanese expert committee.
So this one, we already showed to the public this epic card, but we've all updated the data day-by-day basis. So,
For the Diamond Princess incident, this EPICARB shows that the infection among most of the passengers stopped after the positive cases were confirmed on February 5. And in isolation, the quarantine in the cabin started. In other words, this curve shows that many people were already infected during the socializing that took place on the ship before the port call to Japan and developed the disease late after the quarantine. And I still clearly remember that the criticism calmed down a little when I started showing this data and this graph. So second part is reinforcement of medical service systems. The policy prioritized the establishment of a COVID-19 testing and consultation system based on the National Institute of Infectious Disease and 83 municipal and prefectural health centers separate from private hospitals. By managing the COVID-19 test at the national level, the Abe administration integrated the activities of the national government, local government, medical professionals, businesses, and the public in the treatment of the diseases. Since there are few mainstream medical institutions in Japan that can conduct PCR testing, Prime Minister Abe also made efforts to increase the number of institutions with such kits, including universities and private companies. On February 12, the Ministry of Health and the National Institute of Infectious Disease contracted with a private testing company to handle PCR clinical testing. Since then, the government has been partnering with more private companies to expand testing capacity and develop rapid test kits. The biggest concern of Japanese medical professionals at that time was that uninfected patients with mild cold symptoms would be assumed to be infected with COVID-19, resulting in overcrowding in hospitals. Medical professionals argue that such panic would strain medical resources and risk exposing those infected patients to the diseases. On February 23, Prime Minister Abe instructed the government's coronavirus task force to prepare a comprehensive basic policy. The most important objectives were to prevent the outbreak of large clusters and to reduce the number of outbreaks and deaths. They were concerned about the possibility of large-scale outbreaks that could lead to the collapse of the healthcare systems and socioeconomic disruption. Experts pointed out that Japan's medical facilities were prone to chaos and that many hospitals' beds and resources in the metropolitan area were already being used to care for the 700 infected Diamond Princess patients. They reiterated their warning that a flood of large uninfected outpatients with mild symptoms could overwhelm hospitals and turn waiting rooms into hotbeds of COVID-19. The goal of the Japanese government's basic policy on countermeasure was to flatten the curve. This video shows I explained this basic policy at the videos. So
my name is Yosuke Kita, Senior Coordinator for Global Health, International Division of Ministry of Labor and Welfare, Japan. This is a preliminary translation.
So on February 25, the Abe administration introduced a basic policy on countermeasures against COVID-19 infections based on the advice of an expert panel. Following a sharp increase in the number of infections in Italy, Iran, and South Korea, Prime Minister Abe reiterated the government's decision to prioritize preventing large clusters in Japan as part of its disease control measures. This included canceling large gatherings such as community events and school runs and limiting visits to medical facilities to prevent patients with mild cold symptoms from overwhelming hospital resources, causing controversy. First, he advised local medical institutions that people with mild cold-like symptoms should stay at home and rest rather than seek treatment at clinics or hospitals. He also recommended that people at high risk of infection, such as elderly and patients with pre-existing conditions, order their prescriptions over the phone instead of in person to avoid visiting the hospital for anything other than treatment. The policy is that people with cold symptoms should take time off work and not leave their homes. Government officials have asked companies to allow employees to work from home or commute during off-peak hours. The Japanese government also officially asked local governments and businesses to cancel large-scale events. On February 27, Prime Minister Abe requested that all schools be closed from March 2nd until the end of spring break, which usually ends in early April. A day later, the Japanese government announced plans to create a fund to help companies subsidize workers who need to take time off to care for their children during the school vacations. And regarding our domestic response measures, we have so far been able to prevent medical collapse and mitigate fatal cases through several key measures as follows. Firstly, early detection and rapid response to cluster of infections. Second, ensuring the functionality of healthcare providers, including shoring up their diagnostic capacity. Third, behavior modification with particular attention to addressing what we are calling the 3 Cs, which are closed places, crowded places, and close contact settings. On February 25, the Ministry of Health established the cluster response team. The object of the team is to identify and contain small clusters of COVID-19 infections before they develop into mega clusters. Led by university professors, the team consists of contact tracing and surveillance teams from the National Institute of Infectious Diseases, a data analysis team, a risk management team, and an administrative team. If the Ministry of Health determines that a cluster exists based on a report from a hospital, it will send a team to the site to conduct epidemiological surveys and contact tracing in collaboration with members of the local public health center. After identifying the source of the infection, the Ministry of Health and local governments will take measures such as locating, testing, and placing under medical surveillance anyone who may have come into contact with the infected person. They can also request that infected companies suspend operations or restrict the holding of events. At the front line, municipal health centers carried out not only prospective tracing, which aims to identify close contacts of patients to prevent further spread, but also retrospective tracing, which surveys patients' behavioral histories by conducting through interviews. The Ministry of Health and Welfare found from the result of contact tracing that 80% of infected people do not transmit COVID-19 to others, and that infected people tend to infect multiple people in a particular environment, forming cluster of infections. On March, medical experts review the activity data of the cluster response team and further clarify the definition of high-risk environment and as the 3 Cs. Example of such places are gyms, live music venues, exhibitions, get-together, and houseboats. It is also believed that the cluster do not form in crowded trains because people on public transportation in Japan usually do not talk to each other. So 3C was announced by the Japanese Prime Minister's office via Twitter on March 17. From that time, since that time, the Japanese public has been repeatedly reminded to avoid places, 3 Cs, and the situation where these 3 conditions overlap. And on July, the World Health Organization published on advisory, avoid the 3 C's using language very similar to the used by the Japanese government in English. Later on, the World Health Organization began circulating a global message through social media, and encouraging people to avoid the same 3 C's. So let me introduce an example that characterizes Japan's response. We took a democratic and liberal approach to the response to the pandemic, what you might call a soft lockdown. Japan has never enforced strict lockdown measures and instead has promoted self-quarantine in a way that responds citizens' autonomy. If I may add more, effective and consistent communication by the government has been very important in this regard. So, for example, the declaration of a state of emergency does not have any enforcement. On February, the Abe administration's COVID-19 task force began a political discussion on the introduction of emergency measures to deal with the COVID-19 outbreak. The task force initially focused its discussions on amending the Constitution of Japan, but out of concern that the Constitution of Japan might restrict mandatory measures such as quarantine on the grounds of human rights violations. However, lawmakers from almost all major political parties strongly opposed the proposed proposal. So the Abe administration proceeded with legislative reform instead. So on February, Prime Minister Abe announced that 500 billion yen would be set aside for emergency loans and loan guarantees to small and medium-sized business affected by the COVID-19 outbreak. Benefits to the public were also part of the emergency supplementary policy, but various problems were encountered. Confusion arose in the procedures, such as mail applications being issued earlier than online applications, and the digital transformation of the Japanese government and Japanese society was pointed out as a major issue. In addition, since the program was launched abruptly as a system, there were many sloppy points and the benefit fraud was rampant. For the behavior modification, the Japanese government medical task force expects COVID-19 to enter the country many times over the next 3 years at least. And each time it does, the public will be subjected to a cycle of restricted and relaxed movement. During these periods, governors of affected areas may request citizens to avoid unnecessary travel and temporarily close certain businesses and facilities. And to reduce person-to-person contact, the government introduced the public to refrain from going to high-risk environment, as I mentioned, 3 C's. And last May, the Ministry of Health introduced a new lifestyle that people will practice every day for the long term. Some elements of this lifestyle include behavioral changes called for under emergency conditions, such as avoiding high-risk environment and long-distance travel. However, the program extends these precautions to more mundane activities, such as wearing a mask when talking, refraining from talking when using public transportation, and something like that. In addition, wearing masks in attracting attention as a means of stopping the spread of COVID-19 infections. Even after the pandemic, WHO did not initially issue a clear recommendation, citing insufficient scientific evidence. However, the Japan supercomputer Fugak has some contributed to the making some kind of evidence to the mask using. So nowadays, WHO and also the CDC agreed to recommend the use of masks to the people. So controversy and criticism, I have to touch upon this. In late February, several Japanese media reported that there were people who had fever and other symptoms but were unable to undergo tests at the consultation center. becoming test refugees. One of them was a patient with severe pneumonia. Some claim that many patients were denied tests because of their mild symptoms. In March, testing was still limited to large hospitals with 52,000 tests conducted that month, or 16% of the number in South Korea. The decision to expand testing was made on April, but many articles criticize the number of PCR tests in Japan as being very low compared to South Korea. As I pointed out, we need to improve our testing capacity as much as possible, also for the preparation for the possible future pandemic. And the second weak point of Japan is digital transformation in the society, especially the medical and public health field, as I mentioned the previous slide. And as for the global response, so this is full of the characters, full of points, but I'd like to explain briefly in order to address this unprecedented crisis and build back better building on the concept of human security. The world needs to advance vaccination programs across the globe in an equitable manner. Japan considers it vital to realize the nexus of humanitarian development peace through addressing some perspectives in this regard. Firstly, vaccine, the ACT accelerator and including its COVAX facility is a key initiative. And the Japanese government has already contributed as a co-founder. And in addition to vaccine, we prioritize the universal health coverage as a kind of root causes for COVID-19 control. In terms of our COVID-19 response, Japan is aiming to achieve universal health coverage around the world based on the concept that no one's health will be left behind in a way that is founded on the principle of human security. Infectious disease control is really important, but based on the health system strengthening, and there's a system, the good infectious control system is really important. So Japanese government has already contributed to their developing countries to build up their UHC in their own countries. So at this summary, I would like to touch again that the COVID-19 control in Japan has been relatively good and with relatively few infections and deaths, despite the small number of PCR tests performed and the lack of strict lockdown. However, Japan needs to strengthen our testing capacity and focus on digitalization not only in medicine and public health, but also in the society as a whole. And as a host country of the Olympic Games, we would like to focus on international cooperation in the spirit that no one will be safe until everyone is safe. And lastly, in addition to cooperating on equitable access to vaccines, we will focus more than ever on achieving UHC, which is important in the medium and long term to further strengthen the principles of human security. Thank you very much.
Thank you very much, Mr. Kita, for this enlightening presentation. Professor Haldun Yalçınkaya.
Yes, thank you, Bahadır Sensi. Serhat Hocam, welcome. And it is really privilege for us having you in your busy agenda, just like Yosuke Kita. You are enlightening us for our symposium and the following panel. Let me introduce you first, and then later I will pass the floor to you. For the audiences and the spectators, I would like to remind you can ask your question through the Q&A window. You can type your questions through the Q&A, and after Serhat Ünal's speech, they will be ready for answering the question. Not only Serhat Ünal, but also Yosuke Kita are ready for answering your questions. Serhat Ünal is a medical doctor and professor at Hacettepe University at the Faculty of Medicine, where he was graduated, and also had his internal disease expertise after graduation from the Faculty of Medicine. He is also, just like Yosuke Kita, had degree from Harvard University on infectious disease issue. He is a clinical doctor, but also researcher. He has been making lots of publications, very robust publication agenda he had. He's a member of Turkish Ministry of Health Scientific Committee on COVID-19. He's one of the active members of them. Also, he is leading a team of scientists to conduct a phase 3 trial of COVID-19 vaccine in Turkey among the thousands of Turkish citizens. Thanks to his efforts, the vaccination has begun in Turkey and is ongoing. I think no words would be enough to explain your background, but I would say you had also connections with Japan. So thank you very much, Serhat Ünal, for coming here, and please feel free to use your time. And please unmute yourself. It is very classical for Zoom.
And let me share my slides as well. Dear colleagues, and Dr. Yalçınkaya, thank you very much for your kind introduction. I'm very glad and honored to be part of this meeting and sharing our experience with our colleagues. And I'll try to summarize what we have done in Turkey. But of course, everything will be in the perspective of a clinical medical doctor who is taking care of patients on daily basis. It's the kind of medical view. And we are talking about a big pandemic. You know, the diseases may be endemic, you see every day, maybe an epidemic in high numbers in a certain part of the world, but it may be pandemic covering all the world. And the mankind have been struggling with the pandemic for long centuries. As you see over here, plague was one of the major killers in the world, killed billions of people. And then we suffered from cholera, and again killed millions of people. And then the smallpox and the malaria, and the mankind could defeat those diseases with three miracle things. One is the clean water, vaccination, and the last one is the antibiotics. But after that, in the last century, it doesn't mean that we didn't suffer from pandemic anymore. Pandemic has changed, and the last example is the 1918 influenza pandemic. 50 million of people died because of that. So nowadays, world is suffering from new version of pandemic like Crimean Congo hemorrhagic fever, Ebola fever, Lassa fever, Rift Valley fever, and we are expecting any of them anytime. This is called disease X, represents the knowledge that a serious international epidemic could be caused by a pathogen currently unknown. And it's say unknown, but it is unexpected or surprise. I'm not sure. WHO is expecting that, and the United States, one of the leading countries in the world, is expecting that. By as was said by the President Obama. Just listen to him.
There may and likely will come a time in which we have both an airborne disease that is deadly. And in order for us to deal with that effectively, we have to put in place an infrastructure, not just here at home, but globally, that allows us to see it quickly, isolate it quickly, respond to it quickly. And it also requires us to continue the same path of basic research that is being done here at the NIH.
So what is it saying? We have to be ready. Not only one country, two countries, but all the countries in the world, in cooperation, international cooperation, be ready for such a pandemic. But obviously, not only United States, not only China, as is started from, but any of the countries was not ready for the pandemic. And at the end of 1219, the pandemic has started in China with the history of horseshoe bat, and then to pangolin, and then to man. And that new virus, what we call COVID-19, has learned to transmit from one person to another and started to its adventure. And that coronavirus has tried that before 2 times as SARS and MERS. And in 2003 and 2012, we were lucky in 2003, SARS has stopped by itself with a mutation. And in 2012, the MERS slowed down by itself again. We didn't make, as mankind, we didn't make anything very effective, just slowed down by themselves. But COVID-19, it is very similar clinical presentation, unfortunately, did not slow by himself. And that the very small creature, I would say, smaller than the width of a human hair with an RNA inside, today is causing infection more than 126 million people and killed more than 2.7 million. And here you see, in Japan, the number was not very high, but in Turkey, we are on the list of the most common disease countries, on the 9th one with 3.1 million cases and 30,000 deaths. And the overall, the death in the world was about 2.2%. So it's killing, not killing as much as its ancestors, but killing a lot. And in Turkey, with the population of 83 million, we started to suffer that disease too. At the beginning of 2020, we were aware of the problem. And thanks God, we had the first case a little bit late in between January, February until the 11th of March when we get the first case. We try to fortify our infrastructure about medical infrastructure and training the doctors, and in between try to delay the entrance of the disease into the country by abandoning the international flights, closing down the borders. But whatever we have done, we could not stop it. And at the 11th of March, we had the first case in the country, and then the first wave until the beginning of May. And it was less than 1 million. And Turkey has done all the necessary things like all the other countries, closing down the schools, closing down the restaurants, cafes, barbers, and then partial lockdown, and then total lockdown. And finally, we could control it. And in the middle of May, we started a new life, what is called modified social life, or in Turkish, we call it new normal, mask, distance, hand hygiene, and obeying the rules that has been published by the Ministry of Health, not going into the crowded places, keeping distance, and the closed facilities like the schools and the restaurants and the malls has opened again, but with regulations again. And the summer was quite all right. It was an increase, but slowly. But in September, although we did our best, we got the second wave, and then all the necessary precautions, and we could control it. But unfortunately, at the beginning of this March, again, relaxation on the rules, we are facing the third wave now, and with the daily cases of 30,000 per day and about 100 deaths per day, we are still struggling with that. So the Turkey has done almost all the, I would say, classical precautions that has been done by all of the world. And the next coming 15 minutes, I'll try to underline the things that Turkey has done differently and became, I would say, quite successful about that. So from the first day, we had a decision making, says suspicious of the cases with the probable case definition, and then the testing, and the positive ones are evaluated for the risk factors and for the disease severity. For the ones who has the severe disease or with underlying disease will go to hospital, and the other ones will be followed, would be followed in the outpatient monitoring. And before that, of course, all the healthcare personnel has been trained about protecting themselves, what we call, and they were using personal protective equipment. And we had never been in the state of lack of personal protective equipment. We had enough gown, medical mask, Google face shields and gloves ready anywhere we desired. And the very good thing by Turkey, every single patient who needed a hospital bed could get an hospital bed. Every single patient who needs an intensive care, who needs an ventilator, could get it. And our infrastructure capacity of the healthcare has never been overwhelmed by the high number of the cases. So we say that one of the fever mortality rate comparing to the other countries in the world, in Turkey, was mainly because of that. We could support them very, very appropriately. And of course, we have a younger population. Our over 60 people is about 8 million. So our mortality rate was lower. And the third factor for that, our healthcare personnel did their best, working up to 24 hours, 48 hours. There are terrible photos of them all over the social media. We suffered, and there are martyrs, people who died because of COVID-19 while they were working in the hospital. But we could save the life of the millions as the healthcare personnel. And in the hospitals, we had enough medical support anytime we need. We started with hydroxychloroquine, turned out to be not very effective. Favipiravir, heparin is proven to be very effective, and we use it. Remdesivir and the anti-inflammatory dexamethasone, oxygen, and some other advanced diseases, we had them very available whenever we need. And I have to underline favipiravir over here and thank to Japanese colleagues for that, because it was one of the first international cooperation. Favipiravir is an anti-influenza drug, and the patent belongs to Japan. And with an agreement between Turkey and Japan, we could get this drug and study it. And this is from the clinical you see all those clinical studies that has been done in Turkey with that drug, with Avigan, and we can adopt that drug into Turkey, and we use that drug very successfully since the beginning. And that is because of the first cooperation between Turkey and Japan. We have that, and we are thankful to Japanese people for that. So the hospital side is still going okay. We are happy with that. But the other thing, and as explained by my colleague, you have to follow the patient, follow the people who had contact. And the Turkey was quite successful on that with that one too. We had a special contact tracing system. It's an electronic system, and at the end there are more than 6,000 field teams. Each of them is composed of 3 personnel. So whenever we get a positive case, that team are informed about that through the software, and they immediately go to the area where there is index case, a kind of index case, and all those people around are tested immediately. And as you see over here, 99.5% of all contacts were reached in the very short period of time, generally less than 24 hours. And each contact, we learned that there are at least 5 persons with the confirmed case. And as you see over here, whenever there's a positive case, it has been followed by a specially designed computer program, and the team reached them immediately and isolate them in their home, or when it's necessary in the special units, and they have been given the drug, the favipiravir, and advise what they are going to do if they have more symptoms, even if they are symptomatic or mild cases or asymptomatic. They all have been giving the drug. and we believe that that is possible. It was helpful to avoid the spread of the disease itself. And all that system has been followed by a central lab by the Ministry of Health. And you can see the contact tracing ratio, 99.5. And all those people, the contact tracing completed, how many of them are still going on? And they all have been trained, they followed timely in each city. So the people who are responsible of that can see how many people are diagnosed newly, how many of them are in the isolation, how many of them have been treated. It's followed very carefully because we are dealing with pandemia, and the first thing in the pandemia, what you got to do to stop the new cases. Take the precautions, all the precautions. If there are new cases, find them as quick as possible and isolate them. And the other thing that has been done differently in Turkey, we had a special program, what is called Life Fits Home. At those times, the slogan was, please stay at home, don't get in touch with the other people, especially in the crowded places. And we were telling that you can have a good life without going out of the home. And in that, it's just a symbol, actually. It's an application that all the positive cases have been recorded there in application. And when you have that in your cellular phone, you can see where all the positive cases are accumulating with the red here you see. And sometimes we had times that the whole map was red, actually. Red means the positive cases. Or you can, if you open your location, you can see, are there any positive cases around you? And you can find the hospital, pharmacies, bus, metro stops, everything with you. And if you have suspicions about whether you are infected or not, you can make a questionnaire and it will advise you taking a test at the end or not. And that application nowadays, since the beginning actually, is being using to control the positivity of the people. Because as I've explained to you before, all the positive cases are being taken into isolation at least for 10 days, sometimes for 14 days. But this is humankind. They don't listen to, they go out when they are positive. And this one has been particularly for deaths, because when you go to a mall or when you have to travel with the ship, with the airplane or by bus, you have to get a code for this one. And code means that it shows whether you are positive or not. So if you want to take a ticket to a bus trip, you have to show your HES code showing that you are negative. If you are positive, you have been taken into the custody and take back to your isolation. And step by step, it has been explained how everybody will do it. And nowadays, it's being used when you go into an official building, when you go into a mall, or even when you go into a restaurant, you have to prove your HES code as a security step. So we believe that it was an quite a successful program. And during all those things, Turkey has written down the material for the treatment, for prevention, for hospital follow-up, and we shared them with the colleagues around Turkey as well. And one of the other issue, and it's a good example of the cooperation, is the vaccine studies in Turkey, as it has been explained by the president. With an agreement with the Chinese company, Turkey has helped China to develop a vaccine, because vaccine development, the new development is going through the phases of preclinical studies, phase 1, phase 2, and phase 3. And in phase 3, you need new cases. And at the beginning of the last summer, Chinese company has developed that vaccine, but they did not have enough case to run the phase 3 in the country, so they have to go abroad. And we have done an agreement to check the efficacy and the safety of SARS inactivated COVID-2 vaccine in Turkey in a randomized double-blind manner. And I was the coordinator of the study. we have used a certain amount of antigen vaccine, as you see over here, for day 1 and for day 14. And it has been studied in 2 cohorts, healthcare workers and the people at normal risk, with the randomization 1-to-1 in the first one and 2-to-1 vaccine and placebo control. And we have reached up to 10,220 people, and the CoronaVac arm close to 7,000, and the placebo arm is about 3,500 people. And it has been proven that this vaccine was effective against symptomatic infection, 83.5%. These studies has been done at almost very same time with the Brazil and the Indonesia, but there were some problems in Brazil, still could not publish that, and in Indonesia the number of the volunteers were few. So this publication helped not only Turkey to decide we can buy this vaccine and we can use this vaccine, but helped mankind, showing that this vaccine was effective. And after that study, more than 25 or 30 countries has started to use the vaccine. And the vaccine has been proven to be effective against hospitalization. It means it is serious infections, about 100%. Not only this one, Turkey was involved in the other international vaccine development studies as well. This is the BioNTech-Pfizer cooperation mRNA vaccine. And we have involved in the phase 3 study of this one too. And I was the principal investigator, and we have contributed to that study with the 500 volunteers from country, 250 vaccine arm and 250 placebo arm. And this vaccine is turned out to be 94.6% effective. And the inactivated vaccine that I just explained was studied in between 18 and 59 years of age. This one was over 65. There were about 4,000 people. And with this study, it has also been approved, and both vaccines are being used quite widely in the different countries of the world. And related to the vaccine, as the cooperation between the countries, Turkey is recently has an agreement with Russia. We have done the toxicology studies of this vaccine, what is called Sputnik V, and the vaccine will start to be produced in Turkey soon, and we will be using this vaccine as well after inactivated Sinovac vaccine and the Pfizer vaccine as the third one. We will have this one available in the country. So when we have those vaccines that has been studied in our country and has been approved by the government, Ministry of Health started a plan to mass vaccination of the old people. Of course, there are lots of technical preparation, but the first thing we have to tell people that who is going to be vaccinated first, because everybody would like to vaccinate it. And there was a study group deciding for the prioritization of the vaccination group. Of course, we need first sustainability of the healthcare service, so we have to vaccinate healthcare workers, as all the world has done before, and we have to prevent the deaths, and deaths are very common among the people who are over 65, and with the people chronic disease, we have to prioritize them. And then the continuation of essential services for the community, workers providing service for public's daily life. We have done this prioritization, and then get ready for that. We have to inform the public first, and there were websites to inform the public on COVID-19 vaccine, and then special pages for the vaccines that will be available in the country. What are they, how they are going to be applied, and what are the side effects, and all those things have been published. I mean, not only in website, but there were lots of brochures that has been given to the public. And then government came out with a logistic plan, how many millions of doses we will get in the country and when, and how shall we distribute them, and who is going to make the vaccine when, and who. They all are planned. And Turkey has a strong vaccine infrastructure, actually. Every year we deliver more than 15 different antigens to our pediatric age group and adult, more than 96% penetration rate. And all those plans have been evaluated again. Vaccine distribution, there was a plan for that. Daily monitoring, stock control, storage, refrigerate, mobile teams, and the which vaccine, when will go to where, from which center, and of course, immunization supply chain must be studied very carefully. And to be able to do that, we use a vaccine tracing system that is already on board, so you can timely follow which vaccine is where, under what condition, what is the storage condition. If there is a spoil in the degree, for example, we are going to use now mRNA vaccine, it necessitates -80. So all those preparations have been done by the country, and the security of the vaccine has been guaranteed. Then, according to this plan, we have to reach the public, and we have a general, what we call ePulse computer program. So each person has an account over there, and all the medical records are there actually, and they can punch into the ePulse system and see whether the vaccine is available for them or not, because we have started over 90, over 80, over 70, and the healthcare personnel. If you see your vaccine is available, then they can go into the appointment system, and they can go to the family physician system in primary care, or they can choose any hospital they would like to do, and they go to the hospital or the family physician center, and they get the vaccination. If they are eligible for the vaccine and did not see the vaccine is available, they can directly go to their family system and ask for the vaccination. If the name is not there and they are not eligible, of course, they have to wait for their time. And through this ePulse system, all the doctors and the people can follow their vaccination availability in the country. And beyond that, there was a special program that has been specifically done to follow particularly the COVID-19 vaccination. This is called Vaccinate. And here you can, again, you do the same system, appointment, vaccination, but beyond that, you can inform your side effects through that system. So Turkey, using all those systems so far, have given close to 50 million doses of vaccination. 6 million has been completed, the 2 doses. So we can follow every single person who have been vaccinated, when and which vaccine and where, and what are the side effects. It's possible to follow that. And we are trying to do our best. And as you see over here, Turkey has a daily capacity of, has done 0.35 for each 100 people. But we have the capacity much more than that. We can go up to 1 actually, but it depends on the number of the vaccine that is available in the country. And totally, Turkey could vaccinate it close to 17% of its population, and it's at the 11th level in the world. As you see over here, especially the European countries are suffering from lack of vaccine. And I am not allowed to talk into detail, but Turkey has getting vaccine and helping some other countries to find their vaccine. So there are some countries getting their vaccine throughout Turkey, and lots of cooperation in that field too. But the message over here, as a medical doctor, I always remind that on the other side, we have started to start from the mutation problem. Thanks to God, we don't have this kind of mutations in our country yet, but some mutations are escaping from the effect of the vaccine. So all the countries must vaccinate as quick as possible their people, because the mutations are getting problem. So since the title is saying international cooperation, Turkey is trying to do its best to cooperate with the different countries and try to help some of them. And through that way, the contribution was made to combat the pandemic by 158 countries and 14 international organizations. Some of them are in the grant, some of them in purchase and export authorization, some of them were in financial aids, and those aids were in the form of the medical equipment. The most important thing, I would say, Turkey was in the capacity of producing his own ventilators in very short period of time and help some other countries by sending those ventilators that saves lives actually. And all those international bodies that was in the cooperation list of Turkey. But dear colleagues, in my last slide, as we are talking about the cooperation, this is a worldwide danger. And government on the countries like United States, as I've shown you the President Obama lecture, are aware of the danger, and everybody is aware of the importance of cooperation. But we could not, word could not do that cooperation. I'm not talking about two countries helping each other. I'm talking about the worldwide cooperation. For this kind of pandemics, world must have a master plan. When we get that danger signal, it must be shared immediately. I don't want to blame any country, but the WHO is still trying to understand if China could slow down the information or not. And as soon as we get the signal of danger, a center of excellence groups, one group will start to work about what is this to diagnose. Other group will work about treatment. A third group will talk about vaccination. All those things will be in cooperation. Just look at the vaccination. It was a big race, and each country tried to do his own vaccine. Just a few countries could cooperate on that. It's not worldwide. And the COVAX of WHO is trying to organize vaccine help. But look at the situation. The 85% of all vaccine has been used by 10 countries in the world. And who's going to help them? Who's going to organize that cooperation? So the cooperation between Japan and Turkey must be a good example to all the countries, all the world, and we must get ready for the next coming pandemic. And believe me, it will come in the form of coronavirus, in the form of Zika virus, in the form of influenza vaccine, virus, whatever is that, but we will suffer from this, all those problems, global heating, over-expanding population, loss of rainforest, and the fast travel between countries. It's getting worse and worse. The only way to get out is the international cooperation. And of course, we need people who are expert in international relation, as we are doing over here today. Thank you very much for your attention.
Thank you, Serhat Hocam. I am passing floor to Bahadır Hoca for running the Q&A session.
Thank you very much, Professor Ünal. You can unshare your screen right now. And now I'm looking at the questions. A few more questions are coming. Mr. Kita has already answered many of them, actually. You can also access them. I checked the questions. We are a bit running short on time. So generally, most of the questions are actually focusing on international cooperation. Even though both speakers have mentioned this in their presentations, can you tell a few words? I'm asking to both presenters, starting with Mr. Kita and then Professor Ünal. What are the effects of international cooperation to this? I'm summarizing the questions. Can we feel safe if the rest of the world, the poor countries, are not vaccinated? And what the world is doing about it, what our countries can do about it. Specifically, the questions are for Japan, of course. And what kind of future effect COVID-19 do you think will have on international cooperation relating global health? These are one group of questions. Most of the questions are this. There are also a few questions about the China's rise and its important speculations about the source of the vaccine in China and vaccine nationalism. So can you elaborate on these topics very briefly for like 5 minutes? Can we start with Mr. Kita? Yes.
Can I answer the questions? Yeah, this is my personal view, but I think that as Dr. Tedros at Rachel usually said that no one is safe until everyone is safe for this COVID-19 vaccination. So even in the New York context around the UN field, especially for tomorrow, we are supposed to have informal meetings for the vaccine equity with more than 160 member states. So this is really hot topics because usually the EU and United States and UK are prioritizing their equity and human rights and some other values. But sometimes recently they're prioritizing their nationals to get the vaccinations first. But it's going to be problematic because sometimes they can ban their exporting the vaccine outside of the country. So it is very problematic for other countries, also for Japan. And especially for Japan, we are supposed to have the Olympic Games this summer. And now we are still discussing how we can have the safe Olympics in this summer. But we usually think that no one is safe until everyone is safe is really a good cliche for us, especially for Japanese people who are supposed to have the Olympic Games this year. Thank you very much.
Thank you very much, Mr. Kita. Thank you very much. Professor Ünal?
Well, I'd like to answer that in the perspective of medicine. You know, let's say we have controlled the cases in Turkey, in Japan, or in the United States, and no more cases. But the countries, especially in the Africa, where there is no vaccine, the virus continues to multiply. And as long as it multiplies, it causes mistakes in the nucleic acid, in genetic material, and it causes what we call mutation. And the mutations accumulates and make a change in the physiology, in the behavior of the virus. For example, the British variant, British mutation, has the capacity of sticking to the cell more efficiently. This is evaluation, because virus is trying to live in our body, so he is adapting. So do you know what does it mean when it sticks more? It can transmit the disease with fewer number of virus. In place of 1,000, for example, it can transmit 300 virus. So the precautions, mask, distance, hand hygiene, that is enough for the original one, is not enough for the new, more transmissible one, because it has mutated. And so we have to increase the precautions. And the other mutations will cause the escape of effect of the vaccine. So you can vaccinate, you can be safe, but the new mutation that is resistant to vaccine will multiply and will come back to your country. So what you're gonna do, everything starts again. Of course, you are have more experience. You may stop it earlier, but you will still suffer. And you have to revaccinate with the new vaccine, everyone. So the most cost-effective, most ethical way is to produce as high as possible any kind of vaccine. They all are good, and vaccinate all over the world as quick as possible. I mean, I'm not an expert on that, but if you follow the media, it says that now United States has 3 or 4 times more vaccine than his need. In the same way, England is like that. So United States of America has contributed $4 billion to COVAX, dollars. but you cannot protect the people with dollars. You can protect with the vaccine. So you may have enough money, but where is the vaccine? So the people, countries must come together and find a way to produce more, to distribute more, and to vaccinate more. So I would say that. Thank you.
Thank you very much, Professor Ünal. Thank you very much for participating, coming with us at your busy time. I know things are getting tough in Turkey again, and I'm sure you are busy. And Mr. Kita, thank you very much. It's about 3:30 in the morning in New York right now.
Oh my God.
You patiently was with us. You patiently answered all the questions. We're grateful. Thank you very much to both speakers.
And the last three, I would like to say that I totally agree with Professor Ünal's comment, because this is not the humanitarian, action to distribute the vaccine to all over the world. So, if we cannot secure the, equitable vaccine access all over the world, we may have another mutations, like the Professor Ünal said. So this is not the humanitarian action. We need to have the, strategy to, eliminate, if possible, eliminate the COVID-19 virus. So thank you very much for today. I would like to sleep now.
Yeah, have a good sleep.
Very much.
Thank you.
And I hope one day we can meet face to face together.
Yep.
And thank you for that last note, Mr. Kita. The world is united through this vaccine. So thank you. So please, you're very busy and it's very late. You can leave.
Thank you very much.
We're going to continue with the next panel. Thank you very much for participating. So, Professor Shaban Kardeş, can I leave the floor to you to organize the next panel?
Yeah, thank you, Bahadur Hocam. Actually, in between the plenary session and the panel, we were planning to hold a small break. Our keynote speeches went a bit long, but still, I propose we take a break of now maximum 5 minutes, and then we gather back again at 10:35. This way, our speakers for the next panel can get refreshments, get ready for their own presentations. And in the meantime, we also say thank you to keynote speakers for these excellent, stimulating speeches. Orçun, how are we gonna handle? We are gonna run a jingle in the meantime, and we will be back at 10:35.
Good.
Yes, it's ready.
Okay, thank you then. Thank you for the keynote speakers again. Nasıl gitti? Sağlama güzel konuştu ya. Çok güzel şeyler. Hello again. Let me welcome everybody back to our program after a very short break for refreshment purposes. In the morning, in the first plenary session, we had wonderful presentations by two distinguished keynote speakers from Japan and Turkey. We were lucky enough to have these names who were involved in the policy-making process in their respective countries as regards the response to the pandemic. Now, we will approach the issue from a broader, more academic perspective. We will not confine ourselves to the COVID-19 and the response to the COVID-19 only, but we will try to put this new post-pandemic phase into a broader conceptual framework, and we will try to approach the issue from a more academic perspective. So in that respect, our idea is to contextualize this new policy phase from the perspective of the global humanitarian diplomacy. And then we will try to understand how the two countries, Turkey and Japan, approach this issue. And we will take different cases to study the two countries' response to the global humanitarian medical challenges. And we have four distinguished speakers from Japan and Turkey. First, we will start with the Japanese speakers, and then we will move to the Turkish speakers. Our very first speaker is Professor Kiba from Komatsu University. Professor Kiba is a very well-known name in Japan on this subject, but also internationally. She has been one of the forerunners in the studies about Japan's medical humanitarianism, and she has been running several projects in that respect, together with also in some of the projects Dr. Yasutomi. First, we are going to listen to Professor Kiba. Her presentation title is The Intersection of Humanitarian Diplomacy and Defense Diplomacy, the Case of Japan. She will lay the broader conceptual framework, I think, which will be very beneficial for us to understand the subject. Professor Kiba, you have the floor. You have about 12 minutes or so, and you are now able to share your PowerPoint presentations. Please.
Thank you very much, Dr. Saban. So can you see my PowerPoint screen?
Yes, we can.
Okay, thank you. And good morning from Japan. It's very nice to be with all of you this morning or this afternoon. My talk is about defense diplomacy and humanitarian diplomacy. Don't worry, later I will also talk about health. But let me start from the defense perspective. So before we go, I would like to briefly introduce our self-defense forces. Okay, we don't have military, but we have self-defense forces. So these are our officers and the members. And all these pictures are for trainings. No, it's not an actual war. And our members of the self-defense forces are also engaged with the disaster relief. Okay. The Japanese constitution bans holding the armed forces. So they are not the armed forces, they are not military, and the combat is exclusively allowed for defense only. So we cannot be involved in the war in the other countries. And so the main task of the self-defense forces is actually the disaster relief activities in Japan, because we have a lot of natural disaster, and then they enjoy high public support. Okay, so question, are they involved in any overseas activities? Can they go abroad? Yes, the JSDF also go abroad for UN peacekeeping operations, non-UN missions like Iraq mission, or humanitarian assistance and disaster relief, or HADR, or other missions, like our troop is also in Djibouti for anti-piracy operations. But there's the strict policy is no combat, okay? So they shouldn't be involved in any war or combat activities. And that's why they were involved, they have been involved in more and more humanitarian activities in the past. In the past 20 years, I'd like to argue that there was a very unique intersection between the humanitarian assistance and security initiatives in Japan. In the past 20 years, I divide the phases. This is my analysis, but I believe that there was 3 phases: emergence, mixture, and separation. And now we are here in the separation time of period. And let me start with the emergence of such intersection. It started in 2003. What happened in 2003? The Japan first sent our troops to Iraq after the war in Iraq. Okay? So we were not involved in war, it's prohibited. But we were invited by our ally, our only ally, United States, to be involved in Iraq for rehabilitation and recovery activities. So that's why our troops were there, and they were mainly engineering forces. Okay, they were paving the road, paving the bridge, constructing the bridge. So no combat operation, and sometimes they were involved in the humanitarian assistance or volunteer work like this. So in that period, when they were in Iraq until 2009, Japan's humanitarian and recovery assistance in Iraq was combined with the Japanese ODA, because our self-defense forces can only do the engineering things. No, we cannot do much. That's why we have to combine the ODA and the military assistance, with a metaphor of 2 halves of the whole. That was a government policy at that time. Why? The background was because the Japan need to show off the Japan's contribution to the United States. At least we are here, okay? At least we are in Iraq and we can do something. But we still have legal restrictions, so they cannot do much. And then the Japanese general public strongly oppose the combat-related operations in other countries. Okay? So the government need to mobilize all available Japanese resources, combining the military and civilian. So next period is a mixture period, starting 2009. So in 2009, the mission in Iraq is over, and then what next was the Japanese government started to send the JSDF to South Sudan in 2012. Again, it's engineering, no combat engineering, and some humanitarian assistance. Plus, they had to work with a civilian effort because they cannot do much. That's why to show off Japan, to show Japan flag, they sometimes work with a civilian assistance mechanism. For example, this officer is teaching sewing to the South Sudanese. This officer is teaching IT to the local population. So the question is, it is a task of the military. It should be a civilian aid, right? And another new initiative during that time was the capacity building assistance by the JSDF to Asia Pacific partners, like in Myanmar, Cambodia, Mongolia, and Vietnam, Philippines, almost all over the Southeast Asian countries, plus Pacific countries. So the officers were sent to the certain countries, and they tell them the specific knowledge, such as maritime law, the legal systems, engineering, peacekeeping operations, and technology, also the underwater medicines. So those are the things. And in Papua New Guinea, our officers were teaching the military band as a capacity building. There's another question, okay? So it is a task of the military, or it's just they can be done by the civilians. Okay, so the background of such activity is, of course, the aggressive rise of China, and then the government should do something. The government wanted to show off the JSDF abroad, and particularly in Asian countries. So this kind of, peaceful method we didn't need any legal amendment. Okay, so they say that it's not overseas deployment, it's just a peacetime exchange, a military to military exchange, and there is no legal question. So that kind of disparate measure was found by the Ministry of Defense and Ministry of Foreign Affairs, and it was politically motivated. No, the politicians, our government wanted to do something. They would like to utilize JSDF in legal restrictions. So what we can do is this kind of, aid-like activities. And the JSDF was also involved in the disaster relief in the other countries, like 2013, the massive, the super typhoon in the Philippines. More than 1,000 soldiers were sent from the JSDF to the Philippines, and also the 2015 earthquake in Nepal. So it's more on medical missions. Okay. So during that period, the second phase, there was a severe mixture or confusion of aid and security initiatives. The humanitarian diplomacy was done with ad hoc use of the JSDF. Because of the China's aggressive rise and Prime Minister Abe's proactive peace policy and his focus on ASEAN, so it was very politically driven by the Abe administration, and the government needed to emphasize Japan's contribution, not only to the US, but also to our Asian partners, our ASEAN partners. But still, there is a legal restriction. The JSDF cannot do many things. So that's why they were looking for the disparate measure. But as a scholar, I don't think that it was a good idea. During that period, I was working in Japan Embassy in Thailand, and then I heard from our ASEAN partners that it is very confucius. It's very difficult to understand. Is this aid or security strategy, or are you supporting us or containing China? Those are the questions I received from our Asian partners. And also, this kind of mixture and confusion create more confusion among the Japan watchers or Japanologists all over the world, like Professor Bahadil. But now we are in the third phase, I can say, the separation of aid and security triggered by the security legislation in 2015. And so the 2015 security legislation was a creation of the new packages of law, and then it allowed the JSDF to expand their roles in overseas missions. So they can do much more things right now. And it also allowed the collective defense for the United States. So we can do more for the United States. So even though the law itself is not really utilized yet, but it has a diplomatic signaling effect to the other countries. So it was a diplomatic signal. And since that time, the defense cooperation by Japan is more and more institutionalized. It is not directly linked with that legislation, but in 2016, the Ministry of Defense declared the Vientiane Vision in Laos to institutionalize the defense engagement to ASEAN countries. For example, that kind of initiative is realized in the Japan-ASEAN Shipwriter Cooperation Program. So they spend time in a Japanese ship and learn together the international law, what is open sea, what is the maritime security, those are the things. And then we can show off our uniformed officers to the ASEAN partners. And the first arms export was realized in Asia in 2020. It was our first time, okay, to the Philippines. They gave the air surveillance radar. Okay. So since 2015, the defense cooperation has more autonomous, and then they are clearly separated from the foreign affairs and the aid affairs. Japan's defense cooperation with ASEAN is more institutionalized, and the background is 2013, the Abe relaxed the armed export conditions. So now we can export the arms. And then the security legislation had a diplomatic signal to the other countries. Now the JSDF is more capable, not fully capable. So you can be a partner, you can partner with me, something like that. Okay. And then also the Japan-US security relation is strengthened after 2015, and particularly because of the Abe's strong initiative. This is the Japan-US Security Consultative Committee last week. And then there's more momentum for Quad security dialogue with Australia and India under the concept of free and open Indo-Pacific. And so now our self-defense forces is busier for those multilateral and bilateral cooperation with the new partners. Like this one, the trilateral exercise or Quad exercise in Asia and Indo-Pacific. Okay, so now the defense diplomacy is getting more institutionalized and autonomous. There's a clear cut between the humanitarian one and defense initiatives. So conclusion, there has been some mixture of humanitarian initiative and security initiative in the past 20 years, but now it's clearer. And what's next? It's a COVID-19 and Japan's humanitarian diplomacy. I just prepared a rough diagram. I would like to show what they are doing right now. Okay, so they, of course, as Mr. Kita mentioned, that Japan is committed to the global health. And second, we have bilateral foreign assistance to the other countries, like giving medical equipment or creating the hospitals. And Japan also do the emergency assistance, including the bilateral, multilateral, or assistance through the Japanese ODA. Japanese NGOs. So we still see some old Japan things, like we mobilize the Japanese NGO, Japan-based NGO platform like Japan Platform, and we expect our Japanese nationals in UN to work more to show off Japan. Or we also show off our medicine. The Avigan is Japanese medicine. So we see some of the old Japan resource mobilization concept in our humanitarian diplomacy. However, the JSDF factor, the defense factor, is already severely separated from such initiatives. So JSDF is not involved in any humanitarian assistance under the COVID, and there is no need to look for disparate measure for the JSDF because thanks to the legislation, we can do more. Our soldiers can do much more, and they enjoy autonomy. So defense diplomacy of Japan is already institutionalized and strengthened through a lot of other mechanisms. So now the defense and health or humanitarian assistance, like the military initiative and the civilian initiative, is already separated. And I hope that there is no confusion. Thank you very much. I look forward to answering your comments and questions. Let me stop here.
We also thank a lot to Professor Kiba. Now we move to Dr. Atsushi Yasutomi from Miyazaki International College. He has been also one of the leading Japanese experts on the issue of disaster management, peace building. He has been also involved in the policy relevant academic work, different projects. And today he's gonna be talking about the evacuation of civilians in humanitarian emergencies, especially based on the lessons learned from the Japanese experience in Wuhan. Dr. Yasutomi, you have the floor, please.
Thank you very much. Good afternoon and good morning to you. My name is Atsushi Yasutomi. Thank you very much for the introduction. I don't see your faces, but I hope I am being shown. Yes? My screen is everything is okay?
Your slides are on now.
Okay, thank you very much. So I was also told to speak only for 15 minutes, so I should speak very fast. And also, I would like to talk about evacuation of Japanese nationals and especially lessons from the Wuhan experience. Okay, so today I would like to talk about three things very briefly. Japan's experiences in evacuations and Japan's experiences from the operation in Wuhan. What did we learn from that? And then I would like to specify what kind of lessons, challenges, and what were the political implications can we find from these experiences. Okay, these three things I would like to talk. But before going into detail, I would like to talk about this evacuation of civilians, and I would like to use the word NEO. This is a security term that stands for non-combatant evacuation operations. It's a military operation assisting in evacuation of own nationals out of crisis situations abroad. But Japan Self-Defense Forces uses different terms, and sometimes people use evacuations. But let me stick to NEO for the sake of efficiencies and stuff. Okay, when crises occur, usually civilians first return or move or avoid crisis area by using a commercial transportation, for example, civilian air and so on. But if that proves difficult or fails, then you use a charter civilian transportation ordered by the government, and that still makes difficult and failed. Then comes this government aircraft dispatch and the NEO, military, in this case, Japan Self-Defense Forces. So what we saw in 1998 from Indonesia during the Jakarta political crisis turmoil, we saw approximately 4,000 people return on their own by commercial flights, whereas 5,000 people, Japanese people residing in Indonesia, took flights chartered by the government and then refused to back to Japan or some other countries. I'm sorry, I'm not sure. And also a year later, 1999 March, from East Timor, there are 23 Japanese nationals from East Timor, and by also chartered aircraft to Indonesia. Now, we also experienced at least 4 operations by using Japan Self-Defense Force aircraft, starting in 2004, Samawa in Iraq, when 10 Japanese journalists trapped in heightened security situation in Iraq, and then transported to 10 Japanese journalists to Kuwait. And the following 2013, there's a very famous hostage crisis in Algeria, where Japanese government aircraft was sent to carry 9 bodies. Also, 9 people died, and then 7 Japanese businessmen were also carried. And also, so on, 2016 as well. Also, we saw Dhaka, Bangladesh, and Juba carrying some embassy and other JICA staff members to Djibouti. And then there are some other 8 other standby missions which didn't occur, just a standby. Now, what we know from this past evacuation using JSDF assets is that there were use of Japan Self-Defense Force transportation airplanes or government aircraft in evacuations from political crisis situations. And then they transported relatively smaller number of civilians and bodies, unfortunately, and no evacuation from natural disaster situation until now. And then, of course, this pandemic evacuation from Wuhan proved to be the first evacuation from humanitarian crisis. Now, what happened to this 2021 evacuation operation in January when, as Kita Sensei told earlier, Japanese government chartered as many as 5 civilian aircraft after the Wuhan lockdown in January 2021 and evacuated the total number of 828 Japanese nationals and their Chinese families, family members from the Hubei province where Wuhan is located. and 5 chartered flights in January through February 2021 to and from Wuhan, Haneda. Haneda is in Tokyo. Those are separate dates, okay? And while taking care of super hygienic and medical cares under the very, very heightened media attention. Now, I just wanted to share very interesting comments and testimonies which became really apparent from some journalists' comments and articles released by some top diplomats and civilian witnesses. For example, what were the difficulties during this Wuhan operation? There's a local land transportation was very difficult to carry to evacuation point because bus firms were first very hesitant to provide buses and drivers, and getting local tourist buses was only possible only with the help of Chinese local civilian, and some drivers boycotted and disappeared, and then they had to catch, and then they had to negotiate one more time, and then they agreed to come back. So the local land transportation to evacuation point was very difficult. And also very important thing was the evacuation passengers list. You know, there was a lack of information on registered Japanese nationals residing in Wuhan area and beyond. And so we didn't have enough information about how many people are living in this area, how exactly who are there to getting on board and which flight. You know, these numbers was very difficult to catch. And also, more importantly, there's a getting permission from the Chinese Ministry of Foreign Affairs was very difficult according to some diplomats, witnesses. There were limited flight permissions given only to Japan, US, and Singapore at the initial stage. And there were speculations or discussions, and there were some negotiations or political decisions made the Chinese government. We don't know. We have to put a question mark on that. And also the flights were flown in midnight in order to avoid the Chinese local confusions and protests. So the flight were departed in the middle of the night. And also this I find is very important. The spouses, parents, and children of Japanese nationals who are Chinese were first denied to return or denied to travel to Japan, but also after some negotiation, they were permitted later on. So there are some logistical and also diplomatic problems by carrying these 828 Japanese nationals back to Japan. No, so what are the implications? First, I would like to characterize this Wuhan experience was another wake-up call. It's like a ring for more difficult evacuations in the future to come. Two perspectives. One is logistics. You know, that there are lessons learned from these experiences and also for large-scale evacuations in the future. And these lessons should be analyzed and documented well as lessons learned to apply for future trainings and exercises. Like I told you, data on Japanese registered nationals, how to develop evacuation alert to Japanese residents in the crisis area. And as I told you, arrangements for domestic transportation to evacuation point, which was really difficult, right? But also what I found very important was this military aspect. This evacuation of civilians using the Japan Self-Defense Forces assets in the military crisis. This should, I won't be very surprised if we have this situation. We have to dispatch evacuation mission in a military crisis. I have to point out three important things. One is security in the host country. Secondly, agreement needed from the host country. And then three, cooperation from the host country. I'd like to go very briefly because I only have 5 minutes. First, the security and protection. You know that evacuation operation can be very dangerous May 1996, that there are French operations were attacked, so as was also attacked the Republic of Congo. So we know this situation is very difficult, and it is very surprising that Japan could only charter commercial aircraft to for evacuation until 1994. And the law changed so that the Japan Self-Defense Forces can use aircraft to evacuate. And it was, I have to mention this because we're in the, this bilateral talk. It was lesson learned from the very heavy lessons from Iran-Iraq war in 1985. Japan was not able to evacuate the 215 Japanese nationals out of Iran when there was an Iran-Iraq war. And then Turkish government kindly offered Turkish airline flights for the Japanese nationals to evacuation. So thank you very much. So, and then as Dr. Kiba also told, legislation for security, peace and security of 2015 talked about this evacuation. Okay, Japan self-defense forces can be dispatched for evacuation of Japanese nationals, but it says make sure there are no combats going on in the area. And also this legislation also speaks about relaxed regulations of the use of weapons for protection of Japanese and foreign nationals when they were under attack. But there are questions. Can we rescue Japanese nationals when there is a combat situations? And also, legislation, legal changes were made, but is it possible to bear politically? Are there any political reactions, opinions about public opinions when or if civilians were attacked and Japan self-defense forces fired some weapons and killed during the evacuation? So there's a political issue as well. And second, of course, there's a need to be agreement from the host country. You know, there's no evacuation without this agreement. But what if agreement is delayed or agreement was not given? Then it's going to be a problem. You know, in the past, even during the disaster operations, some states rejected or limited foreign military foreign assistance. For example, Myanmar, during 2005 cyclone, military assistance was even rejected. And during the Nepal earthquake mission in 2015, it was proven difficult to fly over of one C-130 air cargo. And then the Japan Self-Defense Forces decided to use a civilian aircraft for humanitarian assistance. So the agreement is also difficult. And of course, cooperation with and cooperation from the host country is also necessary. This legislation also says that make sure evacuation operation must be done in collaboration with and cooperation from the security agencies in the host country. But the question is like, what about this country is a hostile country where there's no room for cooperation? Or what if this country doesn't want to cooperate at all? Or if it does even, then it should be time consuming, or it should be very complex negotiations and coordination over logistics. And there are so many things about legal clearance and other issues pertaining to evacuation. So there are so many logistics and political issues involved inside. So these three questions were very serious, and there's no way out at this time. And also there are some challenges as well, coordination with other evacuating countries, inter-agency cooperation, intelligence gathering, and so on. I'm not going into details about this. But in conclusion, what did this Wuhan experience tell us? This experience was a large-scale evacuation, no doubt, from natural disaster, depending on how you define natural disaster. But anyway, it was a large-scale evacuation of the kind. And also, more importantly, it reminded us of improved logistics preparedness for more complex and larger evacuation operations in the future. It could be more 100, 2,000, 3,000 people of evacuation involved. We have to learn from the lessons we had. And most importantly, it realarmed the current serious challenges for military operations, evacuation operations from crisis situations, which we already experienced in crises in Algeria, Bangladesh, and other countries as well. And then a future problem concern goes most probably notably in the Korean Peninsula, right? We have to think about these three questions, but we have to solve as soon as possible. Otherwise, we cannot evacuate our own nationals in the crisis area. Thank you very much.
We thank you as well. It was a very good complementary presentation to Professor Kiva's presentation. Now we move to the Turkish case. Again, we have two speakers. Our first speaker is Dr. Bahadır Pehlivan Türk, who is the mastermind behind this project. He's our bridge between Turkey and Japan in terms of academic exchange, but he has been also pushing for looking at this issue in this year's project. So we are grateful to him. He's gonna reflect on the Turkish experience with the global health diplomacy, also focusing more closely on the case of the COVID-19 response. Bahadır, you have the floor now. Please be conscious of time as well to keep up with the timeline.
Thank you very much. Can you see my screen?
Yes, we can see.
Sorry, let me fix it. Oops. Yes. Okay. Yes, in order not to be rude to the next guest that we are going to host here, Pınar Akpınar, let me go very fast with my presentation. Now, basically, even though it has a long name, I'm going to focus on Turkey's what is called the mask diplomacy, and then I will also make some policy proposals for later. Now, this is an ongoing research, and I'm still yet to collect data and make interviews about this. And I'm going to talk about Turkish global health diplomacy and what it's doing in terms of COVID-19, in terms of foreign aid in general, and looking at the basis, the policy basis of Turkey's activities. Now, global health diplomacy more or less has two different definitions. One of them focuses on global governance, about some countries trying to shape the global policy environment. And this pretty much fits to what Japan has been doing through its initiatives in Global Fund and COVAX and etc. Is trying to shape the global environment. A second definition is specifically about what practices that the governments and related non-state actors are trying to do to solve certain global health problems. This is more apt to Turkey is doing. This is a foreign policy tool. Now, the mass diplomacy term, this has actually been used mostly for China. And generally, it's been used with this concept of wolf warrior diplomacy, okay? But I also more and more see the mass diplomacy phrase to be used for Turkey as well. And generally, when they talk about mass diplomacy, what they mean is mostly about an assertion of nationalism, a certain political identity, and internationalization as a global player. So it's about projecting image as a global leader. According to the Diplomat website, it explains mass diplomacy as something to be employed to describe a particular style of soft and sharp power. Soft meaning cultural, symbolic, and discursive power, those kind of methods. And sharp power meaning material elements like dispatch of medical delegations, scientific research teams, and equipment, etc. Now, because the data of COVID-19 is quite limited yet, Even though there is a 2020 TICA report, still details are difficult to get into hand. I checked the discourse of Turkish foreign policy allied, specifically speaking, the Ministry of Foreign Affairs, Çavuşoğlu, and the President Recep Tayyip Erdogan. Now, in order not to take too much of your time, instead of going one by one on these speeches, these are mostly either speeches in some think tanks or the Anadolu Agency's news. What we see is that, this is the summary of it, that things related with COVID-19 related foreign aid, its effect on the world, everything is taken from the foreign policy allied as a part of strategic thinking, as a means to, as a demonstrative element in global and regional competitions in the world, okay? So COVID-19 aid and Turkish activities, not only aid, but I'm going to talk about it in a short while, some other activities, it's about demonstrating autonomy, strength, foreign policy entrepreneurship. And interestingly, especially in President Recep Tayyip Erdogan's speeches, I see more and more an effort to reset and improve Turkish relations with the rest of the world, especially Western countries. There's also a focus on humanitarianism in foreign policy. And we also see that this discourse is directed to domestic audience as much as international audience. So it's a discursive tool for domestic politics as well. Now, what has Turkey been doing? What kind of aid it has been giving to the rest of the world during the COVID-19 pandemic? Well, these are some statements. Again, these numbers have changed and changed through the pandemic because the number of, the problem became much bigger and bigger. The biggest number is 151 countries, foreign ministry officials said, requested help from Turkey. Most of these were answered. And we also see that in different times, Çavuşoğlu and also classified Turkish medical aid during the COVID-19 as number 1, number 2, or number 3, okay, in the world. So I don't really have the comparative numbers yet, okay? I cannot compare it with other countries. And TICA reports just give, it doesn't give value. It gives how many trucks, also in Anadolu Agency news, how many masks, number of masks, what kind of machinery, etc. But it should suffice to say that quite a large number of aid has been given during the COVID-19 crisis, even though a comparison is not possible yet. Now, this is the statistics of Turkish foreign aid. I'm going to focus on global health specifically. As we see, everybody knows, since 2011, Turkish aid to the rest of the world increased. This actually became an important element in foreign policy. It wasn't quite like that in the past, okay? This became an important issue, and it came to almost over $9 billion in the end. This is actually the numbers for 2020. This comes from Development Initiative's Global Humanitarian Assistance Report, and Turkey looks as the #1 country in terms of providing humanitarian aid. The number looks 10 times more than Japan, but there is a catch here. There's something that we have to be careful about. Most of this number, actually, this value is about helping the Syrian refugees, which their number has approached 4 million. The expenses made for the Syrian migration problem, Syrian refugees, is also included in this statistic. So wherever you look, whichever foreign aid agency, reporting agency, an NGO, etc., there's always a clause about Turkey saying that Turkish aid cannot be compared with the rest of the world because Turkey is including its expenses done for Syrian refugees as well. It has helped, no doubt, but it makes it difficult to compare Turkey's contribution. Now, I'm focusing on Turkey's foreign aid in terms of health specifically in my research. Now, if you look at it, actually, it looks like it has an important place in Turkish aid. Now, I presume that the emergency and humanitarian assistance, the #1 item in this list, is the aid to Syrian refugees. And then comes education, which is also not surprising because the Turkish government had to assume many Turkish schools around the world after 2016. And after that, we see that health is #4 item in the Turkish foreign aid. And I assume that its importance will increase in the following years as an effect of COVID-19 pandemic. Now, this is from TIKA report, okay? It distinguished Turkey's aid in terms of health and Turkey's aid in terms of fight against COVID-19, okay? These are two different categories. And in health, you see that it is mostly about infrastructure. This is Turkish, I'm sorry, but maybe you can guess from the icons here. This is about the number of hospitals that is being constructed, the ones that are being restored, and certain medical facilities that are being given, ambulances, equipment. This is interesting, actually, this one. This is health checks, and this is number of surgeries done. It's a quite huge number, okay? So Turkish doctors are engaged in surgeries around the world, and lots of conferences also here. Now, if you look at what Turkey has been doing in terms of COVID-19, we see that it's mostly about protective equipment, masks, and this is aspirators and ventilators, clothes, the protective equipment, masks, etc., sanitizers, gloves, these kind of things Turkey has been handing around. Now, I would like to look what are the factors underlying Turkish COVID-19 foreign aid. Now, generally, if you look at the literature on Turkish foreign aid, and the next speaker has done a lot of work on this as well, three factors are emphasized in the literature mostly, okay? First is that Turkey wants to revive its image in the West, okay? It's an effort to mend fences. You can see it in President Tayyip Erdogan's speeches and also in its various behavior. The second is increasing competition with other medium or large-scale countries. Turkey is competing with Russia and China in the European Union, in the Balkans, competing with Egypt to provide human assistance in North Africa, and it's competing with Saudi Arabia for influence in the Muslim world. And thirdly, there's domestic political reasons. Government is trying to portray itself to the domestic public as a generous hand extended to the rest of the world, and as a country able to take care of its citizens. Now, I would like to add identity into it, and this is religion. Generally, this rests on three factors, actually. Interestingly, about the literature on COVID-19, this is not mentioned, okay? Or at least I couldn't come up with any one of them. But there's a huge, giant literature about Islamism and its influence on Turkish foreign policy since the last 2 decades, basically. But I'm going to approach it a bit differently. Okay, religion is important. You can see it from the geographical and religious focus of aid. It's mostly to Muslim countries, and the evolving of the director of religious authority, Diyanet, in the aid practice. But what I see is that as I make interviews with the people who are actually engaged in the aid activity, like the members of TIKA who are actually on the field, NGOs, Turkish NGOs who are again on the field, and once you talk about them, and when I ask them, these are not methodological interviews, just face-to-face sincere interviews, they immediately say that they are doing this because of religion, okay? But because it's an order from the God, and because they feel connected with the Muslim populations around the world, but they immediately after this, they also say that they're also helping Christians wherever they go. And sometimes the local governments make requests. Sometimes people just come to their facilities for receiving aid, and they're helping them as well. Now, we see this actually in this as well. This is a poster pamphlet created by Anadolu Agency. Of course, the focus is Muslim countries, but you see Georgia and Colombia in it as well. Now, the gist is that actually I have the same experience when I talked in Japan to high-level Japanese officials and also to JICA officials who are actually, and NGOs who are engaged in aid. As you go high up in the hierarchy, approaching near to the level of foreign policy allies, the things for aid, the reasons for aid, including the COVID-19, is given as strategy, international prestige, and security. But as you go down to people who actually engage in foreign aid practice, they will tell always cultural things as a responsibility as a human being and some historical connections. This is true for JICA, this is for TIKA as well. Again, this is not a methodological study I did. This is just the interviews. So I take this fourth factor not as a political ideology, but more something like cultural proximity, cultural affiliation, and in a sense, I hope it will not be too controversial, but I'm going to say it's a limited Turkish internationalism. Turkey doesn't look to the whole globe in terms of aid, but actually it has started to expand its horizon in terms of a foreign aid given country, started with Turkic republics, ethno-linguist connections from ethno-religious connections, and they seem to have some tendency to expand it to the rest of the world. Now, these are the institutions involved in Turkey's global health diplomacy. Of course, TICA is the flagship, and most of the others have their own policies. They also develop their own methods. Interestingly, not all of them are for foreign students, but many of them for Turkish citizens. But I would like to single out specifically, or mention specifically, Turkish Airlines and Ministry of Foreign Affairs, especially the diplomatic corps. Similar to kind of going parallel to Professor Toyotomi's speech, Atsushi's speech. Now, Turkish Airlines has been quite active, of course, to bring home citizens, okay, when the COVID pandemic started. In the later stages of the pandemic, ambulance airplanes came to be necessary, and working together with various agencies, but especially the Ministry of Foreign Affairs, they brought Turkish citizens back home. Now, Turkish Airlines ranks second in European daily flights. Okay, it flies all around the world. So when it cut its flights, this had an important effect. And International Red Cross, actually, with the Turkish Red Cross, they are discussing a project to launch a joint disaster humanitarian aid center at Istanbul airport, because from there, with one flight, you can reach to a huge part of the world. So Turkish Airlines, interestingly, is one of the partners of Turkish aid and global health diplomacy. And secondly, it is the Ministry of Foreign Affairs. So again, paralleling to our guest speech, Turkish Ministry of Foreign Affairs immediately established a help desk. And through the pandemic, 150,000 calls were made, also the Facebook and Twitter accounts. Most of them were actually asking for help, and most of them about the termination of flights during the pandemic. So people were stranded abroad. Sometimes source countries also, other countries also ask for aid. And the target country changed during the pandemic according to the situation, getting good or bad in different countries. So by 30 April, 65,000 citizens, quite early in the pandemic, if you think about it, were brought home from over 100 countries. This number surpassed 100,000 by September. And 30,000 of them were placed in student dormitories, 154 student dormitories by April. In later stages of the pandemic, citizens who were not able to come back home, they started to get sick. And in some countries, the health system is very, very weak. And the Turkish Ministry of Foreign Affairs diplomats, I would like to cite them, they worked very hard. This was a huge logistical task. And they tried to reach them in the hospitals, bring them medicines if necessary. And at one stage, because they were almost abundant because of the weakness of the health systems in some countries around the world, they started to organize ambulance flights, and they carried the citizens, sick citizens who are COVID-19 showing symptoms, and brought them to Turkey. Together with them, actually many non-citizens were also brought to Turkey, mostly relatives of Turkish citizens, and they preferred to get treatment in Turkish hospitals because of the problems in their own country. So this was a huge task, a huge logistical task, and I would like to cite Turkish airline pilots and especially Ministry of Foreign Affairs diplomatic corps for putting citizens before themselves and their families. Now, lastly, I would like to make a proposal for what jointly Turkey and Japan can do to promote global health after COVID-19. There's these concepts of South-South cooperation and triangular cooperation. Because not to take too much time, I'm not going to go deep into it. South-South cooperation is about aid cooperation in the South, between the Southern countries. Now, triangular cooperation is when a traditional donor country like Japan or a multilateral organization facilitates South-South initiatives, countries helping each other, training each other. There's an office, the United Nations Office of South-South Cooperation is there, and this is one of the big topics. Now, as a matter of fact, Japan and Turkey is already involved in South-South or in triangular cooperation. This is actually from the homepage of JICA. And you can see in Japanese Ministry of Foreign Affairs site and JICA's site, websites and documents that there's a special importance Japan attaches to Turkey. According to the JICA, Turkey is one of the priority areas of JICA's assistance to Turkey. And one of the priority areas of JICA's assistance to Turkey is South-South cooperation. And together with TICA and JICA, Turkey and Japan has made lots of cooperations, giving aid to countries in the region, Balkans, Central Asian countries, Middle Eastern countries. And most of these were actually in the field of some technical expertise, energy issues, environmental issues, and things like that. There's actually a MOU signed between JICA and TICA about these. And the goal here is that the goal is to use both countries' advantages and increase the connections in the world and make countries help each other. So the advantages are there's Japanese health system is legendary. Japanese people are the longest living people in the world. And Turkey's achievements in providing universal health access to its citizens is the most conspicuous success of the Turkish government, I believe. And their accumulated expenses, when they merge their experiences, it can be quite fruitful. So they can come together and establish some global health initiatives, or at least some training programs for administrative or some technical things for the rest of the world. There could be additional reciprocal benefits. They can benefit from each other's reputation in the third countries. And Turkey has its own cultural access to certain regions. Japan has its own. So there will be an improved cultural access if they join forces. And the good training of the Turkish personnel and the relatively fresh experiences of Turkey as a recently developed country can be helpful. And both countries have widespread existence around. And it's also the triangular cooperation is about reducing costs. Japan, instead of aiding directly, it makes its aid through Turkey to Turkey's region, kind of makes it cheaper, okay? So there are all these advantages, and Turkey and Japan, JICA and TICA are already engaged in triangular cooperation. So why not do it in global health after COVID-19? Thank you very much. I hope I did not take too much time. And we can continue with our next speaker, I suppose.
Yes, indeed. You did not take much time, but you took a bit of time. Now we move to the last speaker, Dr. Pınar Akpınar from Istanbul, Sabancı University. As Bahadur also did mention, Pınar has been one of the few Turkish scholars to study this interesting area of Turkish foreign policy. She has conducted some projects in the past, and now she is our last speaker to talk about Turkey's activities, especially in the context of Africa. Pınar, you have the floor.
Thank you very much, Shaban. Thank you to TOBB University for inviting me today, and the Japanese Embassy for sponsoring this event. So I'm sharing screen. Okay. Just a second. Okay.
Okay, we can see it.
Okay, excellent. So today I will talk about Turkey's medical humanitarianism in Africa during the pandemic. So in my presentation, just a second. In my presentation, I will try to answer these three main questions. How has Turkey risen as a humanitarian agent? First, give a background on Turkey's emergence as a humanitarian agent. What role Turkey's medical humanitarianism play in its broader policy? And what role Turkey's pandemic diplomacy play in its Africa policy? And I will end with some concluding remarks. So let me give a brief definition of what we mean by humanitarianism. There are various definitions, but the basic simple one is that humanitarianism is the belief and dedication in the value of human life. The four principles of humanitarianism, which is also in the UN Charter, are humanity, impartiality, neutrality, and independence. And humanitarianism has been internationally institutionalized, although its history goes back to the emergence of mankind. The institutionalization of the term was through the establishment of the International Federation of Red Cross and Red Crescent Societies in 1919 following World War I. When we look at the humanitarian agents, we see the individuals, the communities, the non-governmental organizations, states, and regional and international organizations. So what do we mean by medical humanitarianism? A simple definition is the delivery of health-related services in settings of crisis. And these crises can be famine, natural disasters, as well as conditions of extreme poverty, deprivation, and structural violence. And right now, the COVID-19 pandemic. So when we look at Turkey's rise as a humanitarian agent, although if we go back to the history, we see various examples of the Ottoman Empire taking humanitarian initiatives, and also Turkey, various examples we can see. But we see the rise of Turkey as a humanitarian agent from the 80s onwards, and especially in the last 10 years with the Syrian crisis has been a major trigger. So in the 80s, Turkey took part as a humanitarian aid in the Afghan, not only the Turkish state, but we also see the humanitarian NGOs. In the 1990s were also another important trigger. The Chechen wars in the 90s, the Palestinian cause, globalization as a global phenomenon also played a role. The famine in Somalia, I will give you the details of that in the following slides. The Syrian crisis, and finally the COVID-19 pandemic were some of the international triggers that paved the way for Turkey's rise as a humanitarian agent. When we look at the domestic triggers, we see the 1999 earthquake as a major event. Thank you to the Japanese government for their help during this earthquake. There was a huge earthquake, and during the earthquake, the people, the individuals, the NGOs, the state, they took on very important roles in overcoming the troubles during the earthquake. Turkey's EU accession process also played an important role, especially in the rise of the civilian actors in Turkey and the rise of the NGOs. The increasing level of prosperity, which has been unfortunately falling in recent years, but when we look at the 2000s, for about 10 years, we were able to see an increase, which played a role in Turkey's rise as a humanitarian agent. The domestic climate of confidence, again in the 2000s, in the beginning of the 2000s, and the Syrian crisis was another trigger. When we look at the main clusters of Turkey's humanitarian activities, actually, Dr. Bahadur touched upon this. I think my presentation is quite complementary to his. We can see three main clusters. Basically, the emergency assistance and medical relief is the first one, which can also be as a short-term initiative. Building infrastructure, which is more mid to long-term, and investing in social human capital, which is a long-term, which has a long-term target in Turkey's humanitarianism, which also involves education and so on. So today we will talk mainly about the Turkey's emergency assistance and medical relief and its medical humanitarianism. Basically, Turkey's medical humanitarianism is in the intersection of Turkey's growing health industry and humanitarianism. Turkey's health industry has been growing in the last 15-20 years. Health tourism is quite common, like Turkey receives many people coming from the Middle East, Europe, and other regions coming to Turkey for health tourism. And when we look at medical humanitarianism, we can see that the growing health industry of Turkey and Turkey's rising humanitarian role kind of intersects in this term. It is usually done in the initial phase of the crisis, and it involves search and rescue operations, providing technical assistance, medical relief, providing food, clothing, emergency shelters, utilities, drilling water wells, and among other initiatives. Providing mobile clinics and medical buses are other initiatives, medication, medical equipment, mobile hospitals, and so on. The cataract surgeries that Turkey and especially Turkish NGOs do in Africa and other regions of the world have been quite a brand for Turkey's medical humanitarianism. It provides Turkey with extensive outreach. It's a very rapid surgery. It can be done in 10-15 minutes. So it enables Turkey to reach out extensive populations. It provides with concrete and fast outcomes. It has a very positive impact because in a matter of minutes, you make someone turn from being blind to open their eyes, and it has very long-term results. So these practices are done quite often by Turkish actors, and medical humanitarianism also increases public visibility. So let me give you a brief explanation, an account of Turkey and its COVID-19, its response to the COVID-19 pandemic. Again, Dr. Bahadur also underlined some of these. The first case was recorded on March 11, and the Coronavirus Scientific Advisory Board was founded in January, 2 months before the first case was spotted. And in Turkey, at the moment, there are 16 different studies on vaccination research supported by the government. On March 12th, education was shifted online. Public servants' visits abroad were restricted. All sports events were played without audience. Flights to Europe were suspended, and cultural and artistic events, meetings, and conferences were postponed. During the pandemic, more than 100,000 Turkish citizens have also been repatriated, which is the largest scale repatriation operation in the history of the Turkish public. And this data is derived from a recent report published by the Directorate of Communication of Turkish Presidency and the Turkish Foreign Ministry websites. And when we look at the numbers, as of yesterday, Turkey is the 9th in total number of cases in the world with more than 3 million. It is the 19th in the total number of deaths with more than 30,000, which is actually 1% of the overall cases. The world average is 2%, so it's half of the world average. It is the 7th in the total number of recovered patients with more than 2 million, about 2.8 million. And the pandemic created massive economic crisis in Turkey, which was already underway before the pandemic. It raised public criticism with respect to the increasing numbers. The slow pace of vaccination in Turkey also raises public criticism. The lack of access to all vaccination, the vaccine brands is another source of criticism. And the lack of sufficient access to online education are some of the public criticisms in Turkey regarding the COVID-19 pandemic. So let me touch upon Turkey's pandemic diplomacy and Africa. Turkey has been delivering aid to other countries during the pandemic. And when we look at the numbers, we can see that it is the third provider of aid during the pandemic. And when we look at the continents that Turkey has been delivering aid to, we can see that Africa is the first one, Europe is the second, Asia is the third, and then comes America and Oceania. In total, 157 countries have received Turkey's aid during the pandemic. I wanted to compare these numbers with Turkey's ODA in the previous year, in 2000. You can see the 2019 and 2018 numbers here. And when we look at the previous year, this is derived from TICA reports, we can see that Asia was the first continent, especially the Middle East, actually. Here we see it as Asia, but Middle East and Syria is the main recipient. And after that comes Europe, and Africa is actually the third. And when we look at the countries, you can see Syria is the first. In Europe, Bosnia and Herzegovina is the second, and then comes Iraq, Palestine, Afghanistan. And we can see Somalia from Africa as the sixth country receiving Turkish aid. I would like to talk a little bit about Turkey's Africa policy before dwelling further into its pandemic diplomacy in Africa, so that we will have a background and clearer picture of Turkey's intentions and initiatives. Africa, although in the past, in the Ottoman Empire, or during the Turkish Republican history, we can see some involvement in Africa, of course, especially North Africa. But Turkey's main opening into Africa, or a more extensive opening, let's say, started in 1998 and accelerated in 2005, which was basically announced as the Year of Africa by Turkish officials. The number of Turkish embassies in Africa increased from 12 in 2009 to 42 in 2020, and 2 more embassies are planned to be opened this year. Turkey has 22 TICA coordination offices and 42 embassies in the continent, reaching out approximately to 96% of the total population of Africa. And Turkey's Africa policy is also in line with Turkey's commitment to the cause of the least developed countries. Turkey has a commitment made to least developed countries, many of which are African countries. So Turkey has been expanding its official development aid to the countries, the least developed countries, also under the Addis Ababa Action Agenda commitments. It is a strategic partner to the African Union. It is accredited to ECOWAS and the East Africa Committee, and is a member of the IGAD and the African Development Bank. When we look at Turkey's economic relations, trade relations with Africa, we can see that it has increased by 6-fold in the last 18 years. So we can see that there's a rising importance given to Africa in Turkey's foreign policy. And in May 2020, actually amid the pandemic, Turkish Foreign Minister Mevlut Çavuşoğlu, during a speech, underlined that Turkey's Africa policy has a win-win approach, and it is based on mutual respect. And he outlined the main dimensions of the policy as economic relations, development and humanitarian aid, educational activism, and the connecting of Africa with the rest of the world via Turkish Airlines flights. He even, during his speech, drew a parallel between Africa's struggle for independence and Turkey's war of independence. And he concluded that Turkey will continue to defend and promote Africa's rights on international platforms. And Africa, interestingly, is also promoted as one of the main orientations of Turkey's new presidential foreign policy, which is entitled as Enterprising and Humanitarian Foreign Policy by Turkish officials. This name was given during the 10th Ambassador Conference in Ankara a few years ago. So Turkey's involvement in Somalia, I would like to touch upon this a little bit because it plays a very important role in Turkey's Africa policy and also in Turkey's humanitarian foreign policy. basically, Somalia and Turkey's involvement in Somalia came to public attention during the 2011 famine in the Horn of Africa that swept the Horn of Africa, and Somalia was in a dire situation. And Turkish, back then, he was the prime minister, Recep Tayyip Erdogan. He was the only non-African leader to visit Somalia in more than 20 years. So it received huge media attention. It was all over the news, in the Western media, international media. And basically, when we look at Turkey's Somali policy, we can say that Turkey's engagement, its engagement with Somalia can be seen as an example of Turkey's engagement with regions beyond its immediate neighborhood, which was an important policy, came up as an important policy in its broader foreign policy. Somalia also offers a gateway for Turkey into Africa. So this opportunity was kind of used to enter East Africa. And quickly, Somalia became one of the two main pillars of Turkey's humanitarian diplomacy alongside Syria. So Syria and Somalia were mentioned quite often by the officials. Okay. So it all started with humanitarian intentions. Turkey also mediated between Somalia and Somaliland. So it can be seen as a quite benign policy. However, quickly, this has turned into an ambitious foreign policy. Turkey now has its largest embassy in Mogadishu. It also has its largest military base in Mogadishu. Forward. So plays a very huge role. Some of these countries, they sent requests to Turkey when the pandemic started, and Turkey tried to respond to all of them. I think about 159 countries sent requests, and Turkey responded to 157 of them. And when we look at the countries in Africa that Turkey, there were about 44 countries that Turkey delivered aid to. We can see Somalia, Sudan, and Libya are at the top. But as also indicated by Dr. Bahadur, there's lack of information still on the exact numbers, exact data. So I think we need to wait a little more to, draw out concrete conclusions. But with the initial data, we can see that Somalia, Sudan, and Libya are at the top, followed by other countries, followed by 41 other countries. And actually, when we look at Turkey's ODA before the pandemic, ODA to Africa, even the overall ODA, the countries, we can see that Somalia, Libya, and Sudan are again the top 3 countries in Africa. So we can see a continuation of that trend. And when we look at the that Turkey does masks, Turkish Red Cross Crescent, which is a semi-state organization, Turkish Cooperation and Coordination Agency, that's named TİKA, the Disaster and Emergency Management Presidency, and other smaller institutions have been involved. And when we look at the NGOs, there are many NGOs that has emerged in recent years as humanitarian NGOs in Turkey, but these are the biggest ones. And also we can see their involvement during the pandemic. The Turkish Red Crescent, again, it can be seen as an NGO or a state institution. The Humanitarian Relief Foundation, Doctors Worldwide, Deniz Fener Foundation, and Beşir Foundation NGOs in Turkish pandemic diplomacy. So as concluding, try to answer the initial, we can say that Turkey inter alia is sufficient. So we can say that its pandemic diplomacy is inter alia used as an opportunity to divert public attention from domestic to the foreign arena. The emphasis on Africa is in line with Africa's promotion as one of the main orientations of Turkey's new foreign policy, and Turkey's COVID aid to Africa is part of its broader Africa policy. It can be seen as a continuation of its broader Africa policy, its LDC policy, and its medical humanitarianism. Thank you very much.
Thank you, Pınar. There were some interruptions with your connection, I guess, because of bandwidth. At times we couldn't hear at the last part, but I guess the broader
I can repeat any questions that
no, the conclusion was good without any connection problem. As our time is almost up, I will just move to the Q&A session as we did in the plenary session. The participants can ask questions through the Q&A function on the Zoom. There are already a couple of questions here. Let me go through them. Oh, a couple of long ones. To our Japanese guests, to Professor Saya Kiba from Taha Acar, he says, in your presentation, while explaining the role of SDF, you mentioned the concept of Indo-Pacific and the rise of China. The question might be a bit private, but I will still I want to ask, do you think, as a citizen of Japan, the role of SDF can evolve and change in terms of engaging in combat in line with the changes in the international system because of China? Is the pacifist position still strong in Japan despite the COVID-19 and China's questionable management of the pandemic and its loss of reputation? He says he is aware of the discussions in Japan, but he also wonders your opinion. Would you like to comment on that briefly?
Yes, thank you very much for the question. Just two things. Well, first, the general public of Japan is fully aware of the changing security environment, particularly the rise of China. So I think there is no objection if the combat-related operation is done to defend Japan, whether it is the China or DPRK, I don't know. But in order to secure Japan's territory and the Japanese people, I think there is no severe objection. So it depends how you define the pacifism. And regarding the constitution, yes, it is still difficult to amend the constitutions because the public is half-half, it's almost half-half. And then even the very strong Prime Minister Abe couldn't move to the constitutional amendment. He was just testing water. But without the constitutional amendment, we can now do much things. So the momentum to amend the constitution is lower than before Abe came. Okay. So the pacifism is only a problem if we send our troops to Iraq, Afghanistan, and then if something happens abroad where the Japan is not involved. But for the security, for the defense of Japan, I think that it's already general consensus that JSDF should move forward. Thank you.
Thank you. Neri Özer is commenting on the event and the contributions of Japan and Turkey positively, and also extends thanks to Ms. Kiba and Mr. Yastomi. It is rather more of comments than a question. Hakan Akın is referring to the so-called mask diplomacy, but at the same time, he reminds the problems encountered in Turkey during the first phases of the pandemic in terms of distribution of the masks to the citizens. So he's asking about this sort of contradiction in Turkey's reaction to the COVID. Would you like to make some comments on that, Pınar Hocam or Bahadır Hocam?
To be fair, I was in Japan when the epidemic started, and there was a mask shortages in Japan as well. So I don't really know. I don't really know the situation at that time in Turkey about the masks.
There was a small problem at one point in terms of distribution, whether through the state, through a central mechanism, or through the private sales. Okay, so it was a problem, a shortage of supply, which was encountered not only in Turkey, but also in many other countries.
I don't even know the amount. Maybe Pınar Hoca, she also said she doesn't know yet, right? I mean, the amount of masks sent abroad, I don't have that information. I'm checking the Anadolu Agency news, and it's not very clear there. So
there were shipments, as we heard, but we can get a count later. The time's up. Are there any other questions at this point? I don't see.
Just one clarification, Yasutomi Sensei Atsushi, Dr. Atsushi Yasutomi. So the Japanese rescue of its citizens was more by SDF. Did I get it wrong? Was it more like a military operation, or the Japanese civil airlines involved in it?
So, as I said in the earlier end of 1990s, that there were some civilian operations, use of civilian aircraft. But the 2006, was it, and onwards, that there were 4 or 5 military operations. It was carried out by Japan Self-Defense Forces, but it was cargo or government aircraft. And the government aircraft is carried by Japan Air Defense Forces.
I see. And in COVID-19, how did it go in COVID-19?
That was a government chartered. So they used the ANA flights. And because the ANA had a special pact with the Japanese government right now and during this period, so it was chartered using civilian commercial airlines, which is ANA flights.
Okay, thank you. Are there any points that you would like to add or ask to the other participants? Pınar, yes.
Sorry, my connection is very unstable today.
Yeah,
I'm connecting from my mobile phone, unfortunately. I have 2 questions, one for Dr. Bahadır and one for Professor Sayakiba or the other Japanese participants. For Dr. Bahadır, I would like to ask, did you interview only the state officials for your research? Did you interview any NGOs? I'm also curious whether the emphasis on religion was made by the NGO participants or the state officials, because you said everyone made an emphasis on that. And when I interviewed the NGOs for my own research a few years ago, the NGOs, yes, but the state officials, they didn't make too much emphasis on religion unless I asked intentionally whether religion plays a role. And for Professor Saikiba, when we look at Japan's humanitarian initiatives, what role do the NGOs play in Japan's humanitarianism? Is it only the state institutions or the defense institutions, or do the NGOs play a role also? Or the other Japanese participants can answer.
May I?
Please.
Yeah, please, if you want.
In conjunction with Dr. Pina's question to Bahadir Sensei, when you talked about this identity for Islam, what was the pushing factor that made people say that this is Islamic mission? Are there any pushing extra pushing factors? What was it before the pandemic?
So I answer, I suppose.
Yeah,
Well,
please, Father.
The last question that Professor Yasutomi is saying is actually, I think Pınar Sensei can explain it better. Just let me say, before it seems to be ethno-linguistic connections, which was Central Asia, but then Muslim countries became the bigger focus later on. Pınar Hocam, if I made this, tried to make this observation very scientifically, making questionnaires and putting in front of them and asking a list of questions, probably I would reach the same conclusion with you. They wouldn't really focus on Islam. This was done in very informal way, in meetings, face-to-face talks. And the focus actually was here, the practitioners of foreign aid, actually the TICA personnel on the field. And yes, some NGOs, this was actually in a meeting, okay, done in non-methodological manner. That was actually IHH actually member, for instance. And unfortunately, I didn't record, I wasn't doing that research at that time, so I didn't really record it down, sadly. So that they actually very clearly said that they are doing because it's an order from Allah, okay? And they were very much engaged in that. And I can tell you the details, but in an indirect way, actually, there was a huge focus, okay, I felt, that they really, really wanted to look at Muslim populations mostly.
Okay, Bahadir, the point is taken.
Okay. The other thing is that though the upper level officials, I did not interview with the higher level officials, okay? Okay.
Thank you very much. Thank you.
To Pınar's question about Japan, would you like to respond?
Yes. Yes, thank you. So yes, of course, the Japanese NGO is playing a big role in humanitarian assistance. Because we have a Japanese ODA, right? Then ODA also goes to the multilateral international organizations like United Nations and also to the NGOs. Now in Japan, the humanitarian NGO has two types. The first one is a Japan branch of worldwide NGOs such as World Vision Japan or Save the Children Japan. And they are very active in coordination with the other countries. And we also have a Japan-originated or Japan-based NGOs, and they are suffering from lack of funding always, but the Japanese government keep giving fund to such NGOs. And so the ODA, some of our official development assistance money goes to the Japan-based NGOs as well.
Thank you. So that's a major difference between the Turkish and the Japanese model. In the Turkish model, also in the many countries in Europe, especially in the Nordic countries and stuff, NGOs are funded by the government. So their independence is rather questioned. But in Turkey, they are funded by the individuals. And the religious holidays like Ramadan and Eid, other Eid holidays are a very important opportunity for these NGOs to collect donations from them. But they are quite independent than the government, basically.
You see, because in case of Japan, you know, it's also beneficial for the Japanese government to fund the NGOs. Like, you know, they are not using the NGOs, but you know, through the NGOs, they can do much more in the field that the government cannot do. So it's a win-win situation for the NGOs and the government.
Okay, thank you very much.
Okay, thank you. I hope the panel discussion has been also a win-win situation for everybody, for all participants. We benefited from the exchanges, and also the other participants who are listening to the panel. We hope that they did also benefit from this event. And we just arrived at the end of our event. I again would love to express our thanks as the department to the Japanese embassy for the support, also for other keynote speakers as well as our Japanese guests to connect us. As was mentioned at the very beginning by Professor Haldun Yalçınkaya, this is part of an ongoing project. We will make available the event video on our YouTube channel, as well as publishing the proceedings on our website, the project website, turkeyjapan.org. And before I finish, I also would like to thank again to Professor Asena, the Dean of our faculty, to spend her time with us to make a good contribution to our event. And I thank also all listeners for taking their time to join us today. Let me also announce that next week we have another event, similar format on a different theme, which is maritime security. This year we are running two different parallel projects. So next week, with the participation of Turkish and Japanese experts in their fields, we will be discussing maritime security issues in a similar comparative perspective. I wish a good day to everybody, and here I end the event. Thank you.